I want to explore that a little further now, along with some other coronavirus issues, with Huntsville Hospital CEO David Spillers. Thanks for joining us this afternoon.
Yeah, good to be here.
So you heard what the Surgeon General said. What is your prediction for cases in the next week or so, thanks to a lack of social distancing at these protests?
Well, I think we've already up and people started gathering more frequently than we had during the lockdown. That this virus spreads very easily, and people that are out there right now, and I think they'll continue to go up as more people gather and interact.
In terms of coronavirus numbers, how long will it take for us to actually see the impact of these large group gatherings and demonstrations?
Usually within a couple of weeks, you'll start to see some of the cases come in. I heard you say 4 weeks. I think it's a little, we've seen it to be a little less than that.
You said last week, changing the subject a little bit, you're comfortable with the amount of testing being done in our area for coronavirus. Is that still the case, and how is the antibody testing going?
Yeah, I think we're doing a lot of testing. There's a lot of people doing other than Huntsville Hospital Health System. Initially in our community, we were the primary ones doing testing. There's more testing going on now. I think people who want to be tested now are getting tested either by us or others. We've also seen a demand for the antibody testing, and people have started to order that test from the lab. It's still questionable what we do with the antibody tests when people get it back. Testing is adequate. I will say that supplies are a little bit iffy. We week to and sometimes we worry about a shortage the next week of having enough testing supplies, but so far we've been able to manage that.
And you talk about that antibody testing. What is the takeaway from it, and how should someone know if they should go ahead and get that antibody test?
Well, right now, because it's unclear what you do when you get the result. I mean, if you've got we don't know if you're immune to it again. We really don't know what it means. So I'm not necessarily recommending anybody get it. I think some people are getting it now. There's some studies going on, testing people to find out how many people may have had coronavirus and were asymptomatic, and you can possibly find that out through the antibody testing. But, I've said all along, test a lot of people won't, but I'm not really sure it has a lot of value once you get it. The test needs to be ordered by a doctor, and you should discuss with that doctor when you get the results what it means.
Are you comfortable with the rate of reopening here in Alabama?
That's a delicate balance between keeping people locked up and what that was doing. I'll say that as we've opened up and you look at where we are now on the daily cases, we're somewhere between maybe 400 and 500 new cases a day. And because people keep or sick for about 15 days, you can look at roughly 7,500 to 1,000 people in this state that would be sick at any one time if we continued at 400 or 500 a day. I wish it were lower. But I would say between 400 and 600 cases a day really is a number that on what we've seen and that many people having the virus and what it translates to into hospitalizations. It's not very well distributed right now. There are a lot more people in the hospital in the southern part of the state than there are in the northern part of the state, but the healthcare system can handle about that number as long as it doesn't get higher on a daily basis.
Just last night, we saw people gathered in large crowds. They were wearing masks, but they were not social distancing. There are more protests planned as the week goes on. So what would your message be to people as they exercise their right to peaceful protest?
I respect what they're doing. I just hope we can keep it peaceful. We're generally a peaceful community, and I'd like for us to stay that way. But exercise as much as possible. Make sure you keep your mask on. I do think that's important, and I know people debate that, but clearly if you're in a crowd and you're communicating loudly, having to keep you from distributing whatever you have in you out into the public. So go out there, protest, do it the right way, keep your mask on, and let's not get people sick. And
David Spillers, Huntsville Hospital CEO, we appreciate your time this afternoon. Thanks for joining us.
thank you. Take care.